Hi! Welcome to Retirement Dream Builders, where we break down the big questions that shape your future. So, today's video, we're looking at something that affects everyone and everywhere. So, this is healthcare. So, we're gonna mention two countries in this video, the US and the Philippines. So the US and the Philippines have two very different systems. But what if we told you both are doing something surprisingly right? So stay with us because what you learn might just change how you see your options for care. The US healthcare system. So the US healthcare system is often talked about for its cost, but today we're focusing on its remarkable capabilities. So let's start with cutting edge. Again, cutting edge technology and innovation. So hospitals in the US have access to some of the most advanced equipment on earth. From AI assisted surgeries to precision cancer treatments, innovation is constant. Second one, Global Medical Research Hub. The US invests heavily in medical research through institutions, so like the NIH and private research universities. So this benefits not just Americans, but millions around the world. Number three, specialization and access. So thanks to a robust insurance driven network, patients can often choose from highly trained specialists, or for those with comprehensive insurance, access is fast and flexible. And the last one is healthcare workforce. In the US, the average doctor earns $204,000 a year, and nurses nearly 89,000. So high pay attracts top talent and ensures accountability. And the US's model may be complex, but it creates a environment where excellence thrives, especially for cutting edge treatments and specialized care. Now let's shift to the Philippines. Philippines healthcare system, where the approach is rooted in accessibility, family values, and community care. So public and private blend. Now, healthcare in the Philippines runs on a mixed system. So public hospitals serve the general population, while private hospitals offer premium care at a fraction of US prices. Now, PhilHealth for everyone. So everybody knows, or every Filipino knows, what is PhilHealth. So PhilHealth, the National Health Insurance Program, offers access to care for all Filipino citizens. It's a step toward universal health security, affordable yet capable. Now, routine or clinic visits cost just 500 to 1,500 peso. So it's around 10 to $30 US. Even in private hospitals, care is within reach for many citizens, and growing medical tourisms show its rising appeal. Now, human-centered care. Despite modest pay, so let's talk the pay of the doctors here in the Philippines, it's around 42,000 a month. In the US, it's 753.64. And the nurses, they do 32,000 peso for a month, so it's around 574.20 in the US money. So Filipino healthcare workers are known globally for their compassion, skills, and dedication. So the Philippines continues to improve healthcare access while embracing innovation, particularly in telemedicine and rural outreach. So the comparison of the healthcare in the US and the Philippines is the first one, the cost of care. One of the biggest differences between the US and the Philippines is the cost. So healthcare in the Philippines is significantly more affordable, often about one tenth of what you'd pay in the US. So, to give you an idea, a basic doctor's visit in the US can run you a 150 to 300 out of pocket. So in the Philippines, that same visit might cost you 500 pesos to 1,500 pesos. That's about $10 to $30. Even more dramatic differences appear in hospital care and surgeries. For example, a heart bypass that could easily cost $100,000 in the US might cost between $17,000 and $19,000 in a top private hospital in Manila. And that affordability isn't limited to public hospitals. Many private hospitals in the Philippines also offer services at a fraction of US prices. Now, the second one is healthcare quality. When it comes to quality, both countries have their own strengths. So, the Philippines produces many highly trained doctors and nurses, many of whom go on to work abroad. In countries like the US, Canada, and the UK, Filipino healthcare professionals are globally known for their compassion and skill. That said, there is more variation in hospital standards across the Philippines. Private hospitals, especially in major cities, offer care on par with international standards. Public hospitals, while accessible and affordable, can face resource limitation and staffing shortages, especially in rural areas. Now, let's go to the third comparison: public versus private hospitals. So, in both countries, private hospitals generally provide a higher level of service. But here's where the gap widens. The price difference between the public and private care is much greater in the Philippines than in the US. So, in the US, public hospitals often funded by state and local governments, and it is still relatively expensive compared to the global standards. Meanwhile, private hospitals offer cutting edge care but at very high prices. So, in the Philippines, public hospitals are offered truly low cost care to the population, subsidized through PhilHealth, and private hospitals, while more expensive than public options, remain extremely affordable compared to US private facilities. Now let's go to the fourth one: public health care and awareness. Now, here's an area where the US leads public health education. Now, in the US, national campaigns around smoking cessation, vaccination, obesity prevention, and cancer screenings are widespread. Public school systems also teach health concepts from an early age. So, this kind of education drives a culture of prevention. So, Americans are more likely to get screened early and seek prevention care. In contrast, the Philippines faces more challenges here. While progress is being made, especially through barangay clinics and new telemedicine platforms, public health education is less robust and less consistent. As a result, many Filipinos tend to seek care only after symptoms become more severe, which can impact outcomes. Now let's go to number five: system strengths. So both systems have clear strengths. So in the US, structured public programs like Obamacare or the Affordable Care Act expanded access to care and prevention services. The US also leads globally in innovation and medical research. Mainly or many life saving treatments originate in America labs and hospitals. In the Philippines, the biggest strength is affordability and access to basic care. Through a combination of public hospitals, private facilities, and PhilHealth insurance, a large portion of the population can get through treatment, even if advanced care can sometimes be harder to access outside of major cities. So, at the same time, community and family involvement in care is a powerful cultural strength in the Philippines. Support from family is often an integral part of the healing process. Now, number six, public awareness versus cost of care. So, another key difference is the public awareness and how it affects when people seek care. In the US, public awareness about illness prevention is higher. So, people tend to get the regular checkups and screening because public health education is strong and accessible. So in the Philippines, lower public health awareness combined with economic factors often means people delay seeking care until symptoms worsen. That said, cultural support and affordability help balance this challenge, and ongoing efforts are helping to improve education at the community level. So, when you really look at it, both systems have powerful lessons to share. The US demonstrate the value of innovation, education, and prevention. So the Philippines show us what's possible when care is made affordable and family-centered. If we could combine the best of the both approaches, imagine a world where advanced technology meets universal access and compassionate care. So, if this video helped you see healthcare in a new light, make sure to hit that like button. So, we are a new channel focused on helping you build a life full of informed choices and healthy decisions. So, drop a comment what you appreciate most about your country's healthcare system, or what do you think we could learn from other countries aside from Philippines and US. And don't forget to subscribe and tap the bell so you won't miss our upcoming deep dives into health, retirement, and lifestyle system around the world. So your support help us grow and create even better content. See you next time.